Back pain is the most common thing that we see as physical therapists. It's one of the most common things that adults struggle with at some point in their life. And what we see on our end is a lot of people accept it and choose to live with it and think that they have to live with it for the rest of their life. So today I wanted to go through 5 myths of back pain. 1, time will heal my pain. Number 2, poor postures don't affect my back pain at all. Number 3, surgery is going to be my best bet to fix and heal. Number 4, injections are a great quick fix. And number 5, MRIs always show what's wrong with the back. Okay, so going back to the beginning, number 1, time will heal my back pain. So as we're kids and our parents tell us after we've been injured, go have a good night's sleep, you'll wake up, you'll feel better. So when we're young, commonly, especially when it's a minor injury, our body is healing at such a rapid rate. And so we can give our body just a little bit of rest overnight, and then we get back to that activity the next day, and our body can heal really fast, most of the time. Now, as we age, life happens. Right? We fall, sometimes we're in car accidents, or we injure ourselves in so many different ways. And it's just from living. It's not necessarily us doing anything wrong. But so my point is, a lot of things have added up over time. And so there's a lot of layers that kind of have to be unfolded. So muscles start to get tight. Joints aren't quite moving the way that they should. And so we need a little bit of help. And when we look at what does the body need to heal, the body needs blood flow, the body needs circulation, it needs movement. So, when we're thinking, oh, I'll just rest and give it time, and that will make my back pain go away, a lot of times it can have the opposite effect because our body, it was meant to move. And we have to figure out which directions to move in and how our body can kind of get back to all the ways that we want to move throughout our days. Sitting, standing, driving, picking up our kids, all those things, okay? So please don't give yourself time thinking that that is going to be the solution for your back pain when you can get help today. Okay. Number 2, poor postures could never affect my back pain. Now, being in a bad posture is actually, it's okay for a short period of time, right? But the idea is we were meant to move. So if you think years and years ago when, so many people lived on farms and they were working the land and they were, squatting down and they were lifting things up and they were moving, they were really using their body. In this day and age, it's a lot more common, not for everyone, but it's a lot more commonplace to see that people are sitting all day long. Or maybe their back doesn't really like sitting when they're at work. They have a sedentary job, so they got a standing desk. And so then they stand all day. And the point is, our body isn't meant to stay in one position all day. And then on top of that, we need to then be mindful of the position that we're in, right? So if we're sitting at our computer and we can't quite see our screen and we're straining our eyes to read, or we're slouching down in our chairs because, it's easier to reach out in front when we're not supporting our spine in the proper way and we're keeping our body in that position, that can really make a significant effect on our back pain and can really prevent it from getting better and allow it to keep lasting. So we always talk with patients about the positions that they spend their day in. And even if they say, well, I do a lot of driving throughout my day, great. let's go take a look at what is your position, what is your posture like in your car. Because if you're spending hours among hours in the car, we really need to make sure that your spine is supported in that position. So this is just a good reminder to, sit back and think about, how do you spend your day and what positions are you in? And then how could we make some changes to improve those positions so that your spine is better supported and then you feel better when you're in those positions throughout your day. Or taking breaks as well. So setting a timer, making sure that you're consuming your water, so you need to head to the restroom and take a break if you are spending a lot of time in sitting or standing throughout your workday. Okay, so number 3, surgery will be the fix. Surgery sometimes can be looked at as, it should be looked at as the last resort, right? But surgery on your back is a big thing. It's a lot that your body has to go through. And don't get me wrong, there's a time and a place. And so if you're struggling with symptoms, any changes in your bowels or bladders or numbness in that area, like that is something that there's a time and a place where your body may need to have surgery. So I'm not saying that that never has to happen. However, when we jump to that first to solve our back pain, we're missing so many things that could be done first from a conservative perspective and a less invasive perspective. And what we see on our end is once you've had a back surgery, you're much more likely to have more back surgeries. So that's never what we want to see on our end. Someone's body who has been through surgery after surgery, then there's increased risk of infections. And again, the biggest thing is you still need the support and the rehabilitation before and after. So you need to make sure that you're able to get your muscles strong again, that you can find all those right muscles that are supposed to provide your back support and stability, but a lot of times need to be retrained when you've gone that route. So I really urge you to consider all of your options and make sure that you've fully exhausted them. If you're struggling with back pain, surgery should not be the first thing that you consider. Okay, so number 4, injections are going to be magical. They're going to take my pain away. Now, just as we said with surgery, with injections, there's a time and a place. So I have had patients come in who are absolutely miserable, can barely tolerate to even be in a session and work through different very, very gentle movements. Their body, everything is so inflamed. They need something to help get them over the edge. However, they still need the support on our end to work through that back pain and to get them moving more. So when you come at it from the perspective of the injections are going to fix my back pain so that I don't have to do anything else, you're really missing so many pieces and so much support that your back and your spine needs. As we talked about all the postures that you spend your day in, if you haven't worked with someone and really figured out all the little things that you're doing throughout the day that could be contributing and affecting your back pain, those are all going to be lost in the shuffle if you're having an injection thinking, oh, then now I feel great. But what happens in 6 months when it comes back, right? Then you head down the route of that you need more injections and more injections until the body doesn't respond anymore. So please be mindful and understand that there again is a time and a place, but it's not going to solve or address the root cause of your back pain. And number 5, the last one, is that MRIs always show you what's going on with your back. It's amazing and so impressive how far we've come, and it's really actually pretty cool that we can see what's going on in our body from an image. And we don't have to have a surgery to really see what's going on. Now, some of the things to consider is that our spine starts to show some general degenerative changes at age 23. So it's very common for even if you're in your 30s, 40s, 60s, 80s, and you have an MRI of your spine, it's normal to have some changes in there because we know that, unfortunately, we aren't meant to live forever. So some of that is to be expected. Now, what happens when we have these MRIs is that sometimes we see all these things wrong, and then we correlate it with the person and we say, oh, that doesn't quite match their pain. All those bulging discs, like I would expect them to have radiating pain down their legs. And they're like, yeah, I just have like a little bit of an achy back. And we look at it and say, wow, well, that's really impressive considering what's going on. My point is, research has shown us that sometimes there's minimal correlation between a patient's symptoms and the imaging. So we can't put all of our efforts on, well, I'm gonna get some imaging done and that's gonna provide me all the answers and that's gonna account for the root cause of my back pain. So there you have it, the 5 most common myths of back pain. And I hope this kind of gets you thinking and realizing how there's a lot of information out there, but it's how to use it, when to use it, what's going to help your body the most, and look forward to helping and supporting you on your journey to healing your back pain.